let's start at the beginning, and I think give a perspective. So October 1996, can you just kind of take us through that month, just to give us a flavor of where you came from in the space?
Well, the interesting thing about when I was diagnosed in October of 96 is just before that, literally 4 to 6 weeks before that, I competed in the Olympic Games in Atlanta. So I was out racing. I did the road race and the time trial in Atlanta. Didn't have a great race, but I just figured, for whatever reason, 6 weeks later I go home to Austin, or I'm back home in Austin. I start to have all these symptoms, coughing up blood, severe headaches, blurry vision, a lot of things going on. I finally, being a hard-headed athlete, finally go to the doctor, and then I'm diagnosed with advanced testicular cancer. And the blood and the coughing up the blood was metastatic tumors in the lungs. Blurry vision was 2 lesions on the brain, and all the other things that went with it. Obviously, the primary tumor too. To think that I competed a month before that is crazy. But athletes are used to just making excuses, putting off pain, trying to get to the next day, and hoping that the pain will go away.
And so, obviously, you're diagnosed, you have to make these big decisions, and so this is pre-Google. So how does somebody like you end up in Indianapolis from Texas?
Well, for those who don't know, we live in Austin, Texas, and Austin's we like to think of it as the smartest city in Texas. Some people have been to Austin, that's great. But there's not a major medical center there. In 1996, we were scrambling. You know what we did? David, you're not going to believe it. You may believe this, actually, because at the time, you probably had people do it. We went to the bookstore. We went to the bookstore and got as many books as we could on cancer. When we left the doctor's office, we took as many flyers as we could. We literally just took literature and information with us, which is what the internet is today. But it was impossible to go on and Google testicular cancer or Dr. Larry Einhorn or Dr. David Agus or chemotherapy. We didn't know what any of that stuff was, and we didn't have that information readily available. But through a roundabout way, obviously my situation was made public. I started to get a lot of letters in the mail. I got a letter from a doctor who was an oncologist at Vanderbilt, a doctor by the name of Stephen Wolf, and I called him. In his letter, he mentioned he was a cyclist, and he mentioned that I should be careful with the treatment that I pick, and perhaps I should go to Indiana. And so I called him, and he helped navigate me through this situation. He was really my guardian angel throughout the process, and I was lucky and blessed to have him in my life. Not many people have that. Perhaps more have it today because of the information at our fingertips. But at the time, we didn't know where to turn.
Are you still in touch with him?
Oh, yeah, yeah.
Oh, that's great.
Absolutely.
And so you're diagnosed, this horrible thing comes into your life. You turn it for a positive, obviously win 7 Tour de France's. But as important, or more importantly, you start Lance Armstrong Foundation, which evolves to Livestrong.
Right.
And you do that for what reason?
We always thought, the idea of a foundation or a charity started really immediately. It's just a group of us at a dinner table just after I was diagnosed. And I mean, we honestly thought that we would start something then and there, and we would raise, I don't know, $10,000 or $100,000, and this problem would be gone. We would. I'm sitting here 15 years on. I can't, at the time, I never would have thought I would have been sitting here today, and on a lot of levels. But I didn't think that we'd still be dealing with the depth of the problem that we deal with today, not just here in the United States, but around the world. So it started very innocently, and we didn't know what we were doing. We didn't know how complicated it was to start a charity. We didn't know that, we didn't know a lot of things, is the truth. We didn't know that it would evolve into adopting a color. We didn't know it would evolve into a brand like Livestrong. We didn't know I'd get back on the bike and win the Tour de France again, or win it 7 times. We didn't know any of these things, and they just sort of happened over time, and the organization has evolved and grown along with that. But it doesn't take away from the fact that we are still dealing, as you know very well, and I mean, most people in this room know, we're still dealing with a monumental epidemic, not just here in the U.S., but
and why
abroad.
aren't we better? I mean, what am I missing? I mean, what's going
You're
wrong?
asking me?
Yes.
Why
You're
is the
flying
doctor
around,
asking the bike racer?
Well, you're flying around.
Let's time out.
Yes.
Back up. David, why aren't we better? I mean,
I mean, I've got my own point of view
Right.
on it, and but certainly, I believe we're not taking risk. I mean, I believe we have small incremental gains. Your doctor took a freaking risk, right? He gave you platinum-based therapy, and he skipped a drug that would have harmed your lungs.
Yeah.
And we would not be here, obviously, if you had that drug.
You're right. I think I would be somewhere. I think I would have survived the illness without bleomycin, but I would not have the decision that they made in that conference room in Indianapolis back in the fall of '96 when they asked me, "Do you ever want to race again?" That was a simple question. I gave the simple answer. I said, "Well, first and foremost, I want to live. Secondly, if I could ever ride again or race again, sure." Change the therapy, put me on a slightly different protocol. And the only thing it meant was that I had to be an inpatient. So most young men are treated at home and are treated at the oncology ward, and they go home and they spend their time at home. I had to be treated for months and months and months as an inpatient. That was the downside, and that's why most people don't do that. But without that decision, that one compound would have done irreparable damage, and I never would have ever thrown my leg over a bike ever again. So those are the decisions that I think it's easy to take those for granted. I obviously don't, but when doctors make those decisions for whatever reason, I mean, what they're addressing is quality of life, and that's one thing that we certainly have to talk about in the spectrum of this disease. I was given my quality of life back. When I was diagnosed in Austin, and the local oncologist said, "Do you ever want to have children?" And I was a 25-year-old kid. I wasn't married. I had not thought about having kids. I liked kids. I said, "Sure." We made the decision to bank sperm that day. So you go and do that. Boom. That enabled. Now I have 3 children through IVF because of that decision. That is a significant moment in time in my life. The fact that Larry Einhorn took bleomycin out of the protocol and added other things in gave me the opportunity to work again, gave me the opportunity to make a living, gave me the opportunity to win the tour, to grow this foundation because of all that success,
Right.
because of that decision. I mean, it's pretty stunning when you sit back and look at it.
So, I mean, let's brag a little for you. This foundation has given away how much money, or raised how much money since its inception?
Well, we've raised a lot. We've raised about $430 million.
$430 million. So that's how many of these little yellow things?
And you asked how many of the yellow wristbands have we sold, which they were sold for $1 a piece.
Right.
We've sold about 80+ million of those. So that's obviously 80 of the 400 plus. But listen, you asked that question. I get asked that question a lot. People, we clap to that answer. They say, "This is great," but we can't look at it that way yet. The only day that we can really truly stand up and clap, and maybe it's a true standing ovation, is the day that we say we're out of business. That's the day that it's going to be great. That's the day when I can say, "Well, listen, we raised, I don't know what we raised, but we and our partners and all of the people involved in this fight have solved the problem, for better or worse, or for the most part." And we're not there yet. And that's what goes back to the question you asked.
So, our country is so good at reporting the negative. When you have a side effect in a drug, I got to send it right away to the FDA. But I never report the positive. You guys have a new initiative to try to get patients to take their data and put it into a domain we can learn from. Tell us a little bit about it.
Well, I think the idea of people agreeing to share their medical records for the benefit of others is essentially like it's not that much different than a clinical trial. But that's something that this country should be, well, not just this country, but abroad as well, we should be doing better. The fact that, and speaking as a patient, I can still remember those days because I was in Austin, and I did have to go somewhere else, and then I did have to go somewhere else. That is a daunting moment when you have to go into the doctor's office and say, "Doc, I know you just told me 3 days ago that I was diagnosed and my life's on the line, and we have this bond now, but I got to go down the street. I got to get a second opinion, and I might need a third or a fourth. And you should have that readily available and easily accessible." We don't have that today. Most people won't make that trip, and they won't make that ask because they're afraid to insult the doctor. And then, obviously it gets into this discussion of privacy and HIPAA, et cetera, et cetera. I just think we have to get beyond that somehow. I walk into a doctor's office. We all walk into a doctor's office. And what do you see behind the receptionist desk? All our files, sitting right there, all in the manila folders. I mean, how private can that be?
Right, but you're just saying we should insult doctors. That's a...
No,
No,
I
I'm
think
joking.
we should. I think people should. I think people should be their fiercest
I agree.
and most loyal advocates, and they should do whatever they have to do, not just themselves, but their friends and their family and their network of people around them, in order to give that person another day, another year, another decade, another graduation, another grandchild. It doesn't matter. There's no rules there. You do whatever you have to do.
You know, social media is a very powerful tool. And so certainly it took down the governments of Tunisia, it took down Egypt, using it for good in health. Why aren't we doing more of it? Why aren't we doing campaigns against stores that sell tobacco? Why aren't we doing things?
I think we're stuck. I mean, we get stuck. Listen, this disease is stuck. I mean, the burden of cancer is a complacent issue. You could look at, I mean, you're asking me this. I'm flying over here today, and before I took off, I was reading the news. I read the poll that 89% of all Americans are frustrated with their government. 89%. I mean, so there's obviously a lot we can do better. That takes a real level of creativity that perhaps we're too stuck in our ways to do. Certainly, as individuals, we can do that. I mean, I know that we and myself and the foundation use Twitter and Facebook as much as we can, and sometimes it works, sometimes it doesn't. But that's way above.
You have 3+ million followers on Twitter. I mean, so what you say matters to a lot of people. So can you tell the story back in '96 or '97 how you used that to change the Texas legislature?
Oh, 6,
cancer
07,
bill?
yeah. We were trying to pass a bond initiative in the state of Texas called Proposition 15, which was going to allow our state to invest $3 billion over 10 years, which is a lot. $300 million a year is a lot of money, and Texas is an amazing state when it comes to, as you well know, when it comes to cancer research. We lobbied hard. We obviously are in Austin. The Capitol is in Austin. We spent tons of time at the Capitol. There was at this particular, I will make the story somewhat shorter, but at one point there was one particular legislator who was just not in favor, wasn't going to let it happen, wasn't going to see the bill through, which we had to have. Through really the sale of these yellow wristbands, we had accumulated hundreds and thousands of Texans' names and informations and emails and phone numbers, which they had agreed to give us. All we did was simply let them know that there was one particular legislator that was not in favor of passage of Proposition 15. We gave them the email address, we gave them the phone number, gave them the chief of staff, and at the end of the day, that particular chief of staff called and said, okay, we got it.
White flag.
But we will support Prop 15. So in a lot of ways, we almost refer to it as this was sort of the initial or one of the original forms of social media. People could buy into a movement for $1. And so we all, of course, at the time thought it was a stupid idea, but it ended up working. We ended up being able to build this army of people. That's just one example. With that comes millions of other examples of people that have shared their story or have told us their story and are now proudly part of what we call basically a Livestrong army.
So how tough is it to be Lance Armstrong? How tough is it to be a hero
It's not tough.
to every athlete? How tough is it to every cancer patient look to
Until
you as the hope?
I did this off-road triathlon last Sunday. Was it Sunday? I did hit
He
my
doesn't
head.
remember because he fell and hit his head in the
But
race, so there's a little...
And just towards the end of the bike, I crashed and I hit my head harder than I'd ever hit my head on a bike. And so that day was hard to be me. That was not fun. But other than that, it's not.
So the pressure of, cancer patient, we call it the Lance Armstrong effect in our field. I mean, doctors use that term all the time.
Yep.
Is, you are the model for things going right.
Yep.
And obviously, a lot doesn't go right in our field, unfortunately. Yep. But that's a lot of responsibility.
We're supposed to be up here 18 minutes. We're going to
Yes.
lose 18 Americans in that time. You guys have been here for hours and hours and hours. That's hundreds of Americans. So yeah, it doesn't go right. And people look at my situation, I say, whether it's saying, well, wait a minute, Lance Armstrong lived, I'm going to live, or I want to live. Or even calling the doctor's office, if it's Larry Einhorn's office, and it could be a 52-year-old breast cancer patient from Florida calls Larry Einhorn and says, I want Lance Armstrong's drugs. They don't understand that my disease is completely different than hers. It was essentially cured or will be cured, different than hers. Drugs are different. Monitor. Everything is different about these diseases. We're not realistic when it comes to that, and not all of us are really aware of how complicated this disease. You know better than anybody. This disease is so complicated. But listen, you ask about. I think what you were asking me is what is it like to be me and to walk into a hospital? And I get this question a lot. What do you say when you go to a hospital? What do you say to somebody? You walk into the room, they're there, their mom is there, or their husband or their wife is there, their loved ones are there. What do you say? And the answer is I don't say anything. I listen. Because these people, they don't expect that Vince Lombardi is going to walk in and start giving them the tips, boom, boom. They trust their doctors and their nurses for that. But what they do want to do is they do want to share their story. They want to tell their story. They want me to sit there, look them in the eyes, and they really feel that I accepted their story and I listened. And then when they're done talking or they're done sharing their story, I say, hey, I got it. I'm thinking about you. I wish the best, and keep me posted. If I can ever do anything to help, let me know. Let the foundation know. And they love that. They don't expect. I mean, I guess there is an occasion where somebody's like, "What did you eat? Did you ride your bike? Did you?" But most of the time, they just want to be heard.
So, most people who go through cancer care, and those who are very successful at it, most of them don't give their life back to helping people. Mm-hmm. You and Doug Ullman, who heads the foundation, I mean, you're remarkable people that you're giving decades of your life to helping try to change the world. What brought that up? I mean, why did you evolve to be you in that regard? Two things. One, because when I was diagnosed in '96, I had not won the tour once or 7 times, but still it was news. I mean, it was on ESPN, it was on CNN, I suppose. It was in the news. So right. I didn't have a choice. People knew my situation. They knew that I was diagnosed with a particular form of cancer and it was advanced, and they followed it through the media during treatment. But really, I mean, that was a challenge that I got from the doctors in Indiana. I mean, Dr. Nichols, who was really Dr. Einhorn's right-hand man, challenged me in December of '96 as I was leaving the hospital. He said, I want to talk to you about the obligation of the cured. And I thought for a second, this is what he's going to tell me that I've been cured. This is where he gives me the secret. He said, I don't know if you've been cured. I need to see you in a month. It was very, very formal. I need to see you in a month, and in 2 months, and in 3 months. I said, wait a minute. He said, the obligation of the cured is simply the way you walk out of this hospital. You can walk out that side. Nobody knows you left. Nobody knows you were here. You don't have to tell anybody you had this disease. That wasn't really an option because people knew, but I could still choose to remain private about it. Or you can walk out that side and you tell everybody you had the disease. And you do whatever you can as long as you live to affect change when it comes to this disease. And it was December 13th, 1996, and I looked at Craig Nichols, who was my main day-to-day oncologist. I said, you got a deal. I'm going out that side, and as long as I live, I'll do whatever I can to make a difference. Well, obviously, the world is a better place in that regard. So someone today is diagnosed with cancer. I mean, it's a shock, right? I mean, they get hit by a truck. And what do you do? I mean, you've been through this. You've talked to hundreds, if not thousands of patients. The first thing to do is obviously gather information.
Yep.
And start to put together a checklist of what to do. Do you guys have resources for that?
We do. It's of course, we can't keep up with that load. I mean, we have a navigation center at our headquarters in East Austin that deals with anybody who walks in off the street in that particular neighborhood, and we deal with hundreds, if not thousands, of people. But you can't deal with the flow. We, in particular, can't deal with this flow of new cases and new diagnoses every day. And as you well know, it's very difficult to keep up with that. And then as they get put into the system, how we deal with that is an even bigger issue. How we pay for that care, how we make sure that they're receiving the highest and best care along the way, how they're, and you're going to give me grief about this, but how we monitor them and follow up with them after treatment and after they've quote-unquote been cured. Dr. Agus has been on me for months and months and months to do all this blood work and do this and that, and I'm concerned about you. I say, yeah, I'm busy. So I'm the patient from hell,
he said,
sorry.
If you take 1 tube of blood, it's going to take 10 seconds off my race score. And
Yeah.
But the future health is obviously, to me, life's a marathon, and we need to stay on top of everything going forward. And obviously, you guys have built a tremendous survivorship program, which is fantastic, and giving people hope. And hopefully, with this medical records program, we can actually make advances from them contributing to the field. In this room here, we have people from all different industries. And, historically, cancer has been about the biologist, the cancer doc, et cetera. My hope is, we could bring in these industries, whether it be the people from Google or the people from Cisco or the people from any new startup that's in this room, and get them to work about cancer. So, when you look at this and you go around to companies, you go around to individuals, what's the message for the future? I mean, what are you trying to push them? How can we change these things?
I almost felt like calling another timeout and asking the expert.
No, but
But
I by definition haven't done it right. I mean, I'm a failure in that regard.
No, Richard Nixon declared war on cancer in 1971. He created the National Cancer Institute. He funded it with $150 million. And it was like he was saying we're going to go to the moon, and it was going to happen. It didn't happen. I mean, it's been 40 plus years, and we're still here, and we're still funding this disease. We're still chasing this disease. Something, and again, I'm not a researcher, I'm not a scientist, I'm not an oncologist, I'm not a doctor, I'm just a patient. But I can look at the devastating toll that this takes, and something is broken. Something has to be fixed, and I have a tremendous relationship with Harold Varmus, and I go to, just like any athlete, you go to the team. You say, okay, who's coaching the team? Who's funding the team? What are the tactics of the team? What are we doing? What can we do better? What's our 1-year goal, our 5-year goal, our 10-year goal? We're going to lose 562,000 Americans this year to this disease. Next year, we might lose 561,800. For me, I'm not that, the disease taught me to be patient, but I'm not that patient. We've got to change some things, whether it's increased clinical trials, whether it's increased collaboration, which I think is a huge issue across not just institutions and universities, but big pharma, all across the board. We're repeating bad science. We don't need to be doing that. It's difficult. We could do a heck of a lot more with prevention. We could make sure that people are never put in this situation. We could address the tobacco burden in this country. And the list goes on and on and on. When you have a disease that encompasses 500 different types of malignancies, it's complicated.
Right, but we have generic things we can do, generic seroma, we have standard things we can do for prevention. We have things we can do for early detection, but they're not being done in this country. And we need to educate better. We've got to get aggressive.
Yeah, we should be doing that now. Since they tell us now they don't have the money, we ought to be doing those things.
Right.
We ought to be making sure that our kids are our focus, and when it comes to prevention. I mean, if I see a 16-year-old kid that is deciding whether or not they pick up a cigarette and they try a cigarette and they try a pack of cigarettes, the day they just don't do it, we cured that person. Yeah. We cured that person from lung cancer, in my opinion. And so that's the type of mentality we have to get to. It's not the mentality we have today, but all across the cancer continuum, whether it's prevention and early diagnosis and screening and medical research and survivorship and end of life, all of these things we can do better, as you well know. And I said it a second ago, and I'll repeat it. This disease is an old issue. 1971, Richard Nixon, nobody remembers that. It's a complacent issue. They have forgotten that every minute an American dies. That's 1,500 Americans a day. That's 9/11 every 2 days. That is a priority, in my opinion.
And more than half of them are preventable. I mean, that's what's shocking.
Yeah.
Well, we're out of time here. And Lance, I just want to thank you, I mean, from the bottom of my heart. First of all, as a cancer doctor and dealing with cancer patients every day, you are my hero and their hero. And what you do for the field and the hope you bring all of us on a daily basis is what keeps us going. So thank you for being you.
Thank you all.